the Health Secretary, Victoria Atkins, who joins us this morning. And Health Secretary, so much to talk to you about today. Disposable vapes being one of them. What's your view? What's your take? What's the government trying to achieve with this?
Well, good morning. What we're trying to achieve with this consultation and in due course the piece of legislation we're going to bring forward is, first of all, to prevent people from smoking in the first place. You know, I've never met a smoker who is glad that they took up smoking, and I think every mum and dad and carer, none of us wants our children to take up smoking. So that is the motivation of the Prime Minister, is to create the first smoke-free generation. But following on from that, we also have to look at the impact of vaping, because vaping can be really powerful as a quitting tool for adults who already smoke. But none of us think that children should be vaping, and yet the evidence is emerging very quickly that over the last 3 years, for example, the number of children that have taken up vaping has trebled. And so we have listened to the concerns of mums and dads and the wider community, and we are going to be bringing forward a prohibition on disposable vapes, because we know those are the vapes that children tend to use. Some 69% of children use disposable vapes. And not only are they a gateway to nicotine addiction, of course, we know also they litter our streets. There's an extraordinary statistic that in a single week alone, 5 million disposable vapes are either thrown on our streets or thrown in our bins. And so there is an environmental reason behind this as well. But first and foremost, safeguarding children, ensuring that they can grow up without that nicotine addiction, is the reason behind this legislation and this consultation.
And how frustrating is it for you in what feels like a sort of dying administration that you can't even bring forward a piece of legislation like this without it being more of the Tory psychodrama? Front page of the Times this morning, being led by not some minor backbencher but a former Prime Minister, saying that she doesn't agree with this legislation, and to quote, she says adults must be able to make their own choices about their own lives, and Conservative governments should not be seeking to extend the nanny state. And she's just one of a number of rebels expected to vote against this.
Well, first and foremost, this is a long-term decision, a really bold long-term decision for a brighter future. This is not, as I won't use your words, but this is an ambitious and bold move by this government to ensure the future health of our children, not just in the next few years, but in the decades to come. And by the way, just to put it into context, in the short time that you and I have been in this interview, a couple of more people will have been admitted to an NHS hospital with a smoking-related disease, because every minute of every single day a person is admitted to hospital for those reasons. But on the wider issue of the criminology, if you like, of how this bill is taken through the House, bills relating to smoking have always been matters of conscience, and the Prime Minister, quite rightly, is honouring that. But I do think we're going to see a great debate in the House. It's right that we debate these things, but I suspect we'll see members of Parliament wanting to represent their constituents and the concerns of their constituents when it comes to smoking and vaping. Apologies, there's a very loud motorcycle just gone past.
Everything. That's what I would ban.
I can't hear you for the moment, sorry.
Secretary of State, that's what I would ban. The guy on that motorbike with that noise, that would be a ticket for me on that.
Yeah.
But you talk about the evils of smoking, and 2 people while we were doing this interview being admitted to hospital with a smoking-related illness. Why aren't we just banning smoking?
Well, we don't want to ban adults who have already started smoking. And, you know, we know that 4 out of 5 smokers started smoking before the age of 20. So we want to help those adult smokers quit. And so as part of this package of legislation and measures, we're also announcing a doubling of funding into quit services. And that can include things such as the Swap to Quit package, which means is that people can, if they feel that vaping is what will help them quit, then they can talk to their GP and they're able to access reusable vapes to help them do that. But we want to help adult smokers quit, but we want to stop children from starting in the first place, because the evidence is so clear about when that can happen. I mean, some 14 or 15% of 16 and 17-year-olds today smoke, and we want to try and prevent that in the future.
Just lastly, a comment from you, if you will, please, on the incident in Jordan yesterday. President Biden saying that he's vowed action against those responsible. Will we in the UK stand shoulder to shoulder with the United States as we're frankly seeing the tensions in the Middle East escalating significantly with the death of 3 American soldiers?
Well, first and foremost, obviously our thoughts and sympathies are with the families affected by that horrific attack, but also, of course, with the United States. And we have said, the Foreign Secretary has said that we strongly condemn these attacks, and we will, of course, watch this with great concern and attention. But we also call actually on the Iranian-backed rebels and others who are conducting these attacks. We call on them to de-escalate, because this cannot be allowed to continue.